everyone. So first off, the surrogacy system was set up several years ago when Medicare finally realized that providers weren't the ones that were doing most of the enrollments, accessing their records, completing NPI registrations and things of that nature. And frankly, in order to access that information and to be compliant with Medicare regulations, providers are issued login IDs and passwords in order to access CMS systems. The issue is that most people shared those access credentials, and that is frankly illegal and not responsible as far as Medicare is concerned. So they had to come up with a way in order to allow people that are working on behalf of providers and suppliers to do the job for them and to do it legally without sharing access credentials. It's very easy to use. It's relatively easy to set up. Unfortunately, some of the documents out there that Medicare provides are somewhat aged or out of date, and sometimes it's a little more difficult to understand how to set up surrogacy. And unfortunately, there's not a lot of people out there that are training people on how to do this. And when you have large organizations, it can be a challenge to set up the surrogacy program, but once it is set up, your life is much easier. Surrogacy offers quick, efficient access to information. The surrogacy system, once you are a surrogate for a provider, depending on the products the provider allows you access to, you can work on their behalf in NPES, PACOS, and EHR High Tech, which nowadays is going to be meaningful use for the Medicaid program only. It allows you to be connected to all enrollments and files for whichever provider and or supplier that you have a connection to. It offers the ability to monitor those enrollments and applications much more thoroughly than you can if you're utilizing paper applications. It results in a quicker turnaround time. So for instance, paper applications, regulations state that Medicare and the MACs, the Medicare Administrative Contractors, have to complete those applications, paper applications, within 180 days. And those are your normal low-profile providers, those that are not medium or high-risk calculated providers or suppliers. So for the most part, that's 180 days. If you file your applications electronically through PACOS, the federal regulations state that those should be completed in half that amount of time. So as I stated, results have a much quicker turnaround, and it offers improvements to the business functions. You have much more access and ability to do things once you're doing it electronically than you do if you're doing it on paper. So let's talk a little bit about identity and access accounts. So there are a couple of different types of accounts you can have. You can be a provider or supplier. Now let's discuss that just a little bit. Medicare determines that a provider, their definition of a provider, is someone more of an organization, something like a health system, a hospital, a surgery center, a larger organization is what they call providers. In our world of provider enrollment, credentialing, just HealthCare society as a whole, we call human beings providers. Medicare calls them suppliers. So most human beings, physician groups, things like IDTFs, those types of suppliers, those are actually called suppliers. Then you have an employer on behalf of a provider or supplier. So let's say you're a group practice, you can have an account. Now the accounts in INA are all for human beings. You're not going to have an account for an organization. You will be a person, a human being that represents the organization through their account in INA. So when you register an account in INA, it needs to be for a human with an email address, social security number, and a date of birth, because the human being will be vetted by the system to verify that they are allowed to work with Medicare. Then, lastly, you have third-party vendors, such as myself, Zetter HealthCare, billing companies, credentialing companies, things of that nature, or even an MSO, management services organization, that may be handling provider enrollment and or credentialing for providers or the organization. That would be a third-party vendor. So those are the three types of accounts you would have. Now, the options for those accounts, depending on whether you're the provider or supplier, or whether you're acting on behalf of the employer that employs the providers and suppliers, or you're a third-party vendor, the main person is going to be the authorized official. That will be the gatekeeper for the organization of which that person is the AO, or authorized official. That authorized official can authorize delegated officials to work on their behalf. And that delegated official would have certain responsibilities delineated by that authorized official. Then last but not least, an authorized official and a delegated official may assign staff end users. So for instance, in Zetter HealthCare, I'm the authorized official. I don't have any delegated officials, but I do have other staff end users. So Cheryl and Sandy and Jacqueline and Barbara and Amy in my office are all staff end users that can process applications as well, and I can assign them certain clients that we have or certain providers that they would be working on.